In a world of consistent lockdowns, restrictions, and border closings, a new threat has risen. And in a world slowly returning to normalcy, we ask, are we ready for the new threat? Alpha, Beta, Gamma, and now Delta, all variants of COVID-19. The past 16 months have been a never-ending story of the tale of COVID-19. Hello and welcome to On the Record. I'm your host, Jerome Sawyer. We have seen over 13,000 confirmed cases of COVID-19 and around 256 direct deaths as a result of the virus. But that doesn't mean we're down without a fight. Approximately 1 year after our very first confirmed case, the Bahamas began its vaccination campaign to hit back at the ever-increasingly dangerous COVID-19. To date, almost some 100,000 total doses of the vaccine has been administered, with over 60,000 receiving their first dose and almost 40,000 fully vaccinated. But now a new threat arises, one that can possibly jeopardize all of the great strides in this ongoing war against the pandemic. Tonight, On the Record brings you the new threat as we sit down with public health and infectious diseases specialists about what these new variants mean for us. Don't go anywhere. Our program begins right after this break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. And welcome back to On the Record. I'm your host, Jerome Sawyer, and tonight we bring you the new threat, an in-depth look at the newer, more dangerous variants of COVID-19. Just when we were beginning to let our guards down, so to speak, and experience some level of cautious optimism, here come new virus mutations. With Delta now becoming the dominant strain of the COVID-19 virus within the United States, it could only be a matter of time for us.
The Delta variant is ripping around the world at a scorching pace, driving a new spike in cases and death. In places with high vaccination coverage, Delta is spreading quickly, especially infecting unprotected and vulnerable people and steadily putting pressure back on health systems.
Well, to help us understand the science behind these new variants is the director of the HIV/AIDS and Infectious Diseases Program, no stranger to us here on the Record, Dr. Nikkiah Forbes. Dr. Forbes, welcome to On the Record once again. How are you?
Good evening, Mr. Sawyer. I'm fine, thank you. Good evening, Bahamas. Always a pleasure to be here with you.
Well, Dr. Forbes, we've been hearing a lot about the fact that the COVID-19 virus has mutated and has different strains, the latest one being the Delta strain. But if you could break down for us these different strains to let us know what the Alpha, Beta, Gamma, and now Delta means for us.
Sure, and so basically these names are names that have been given to variants of COVID-19 that are called variants of concern. So viruses mutate. That happens naturally. That happens very regularly. But you have to be concerned when viruses mutate, and that changes something about them that either makes them more infectious or more deadly. And so these variants that we're hearing about now, alpha, beta, delta, are certain variants that have been identified that are indeed more infectious. So more people get hospitalized. And so it stands to reason that they may have a worse course because there is more of these variant COVID strains in their airways. So alpha was originally the strain that was identified in the United Kingdom. It was called B117. And beta was identified in Brazil first in a traveler that was in Japan. And delta was originally identified in India. And the delta variant is particularly concerning because it's actually 60% more infectious than the alpha variant, which was more infectious than the original COVID strain. So that's very concerning. It is spreading very, very quickly. And so with this increased infectious strain going around, it is causing pressure on multiple countries and responsible for surges again. Now, the great thing about these variants is that the public health protocols work to protect you against these variants, and also vaccines are somewhat effective against these variants. There is some reduced effectiveness, but it's still effective. I'll give you an example. The AstraZeneca vaccine is 60% effective against getting COVID-19 from the Delta variant. And if you had one dose of the COVID-19 vaccine that's made by AstraZeneca, that can protect from hospitalizations from the Delta variant up to 71% effectiveness. And if you've had 2 doses of the AstraZeneca vaccine, that's up to 92% effective against hospitalizations against the Delta variant. So there still is some good news. Now, regarding these variants of concern, we can expect that while COVID-19 is still spreading worldwide, and it is, up to yesterday, there were 187 million lab-confirmed cases worldwide. As long as COVID is continuing to spread, the virus will continue to change and mutate, and that will create more variants that could be more infectious or deadly. So we definitely
two questions I've got. Have we been able to confirm which strains, if any, have shown up in the Bahamas? And as this virus continues to mutate, is there a concern that the vaccines will continue to be a level or a layer of protection?
Great question. And so we are doing surveillance for variants. So as of the last report, we have not confirmed that the Delta variant is here, but we have to remember that in our region, for example, in the United States, the Delta variant is the predominant circulating strain. We know that for COVID to spread, we just need to travel to the US and get infected to bring it back, or visitors. And so it is not unlikely that strain is here. It's fully possible.
Still very, very scary. I want to come back to that at some point. But a larger problem that we're seeing, just last week, we would have noted that the Princess Margaret Hospital was at maximum capacity with COVID patients. Mary Walker, who's the administrator, said that none of the patients being cared for had been fully vaccinated. Explain for us the correlation between full vaccination and hospitalizations, and if it is the best shot at survival.
I hope you're hearing me because the screen is frozen on my end. So at the Princess Margaret Hospital, some researchers and myself, and those other persons include Dr. Hilary DeVoe, Dr. Wesley Francis, Dr. Ajita Wallace, Dr. Krista Wells, Dr. Darbyl Hunt Burroughs, we're keeping a close eye on the vaccination status of our admissions and the people who don't do well from COVID and die. And I can share with you that the data we have is that persons who did get hospitalized, more than 98% of them were unvaccinated. There were a few patients that had 1 dose of the vaccine, very small number, and there has been nobody who's been fully vaccinated at our site. that has been hospitalized or died. And so indeed, vaccination works. And that is our experience here locally. And the global experience also confirms that vaccinations work to prevent hospitalizations and death.
But yet there is still this hesitancy. Do you think that people just don't understand? They don't get it? I get it. People are concerned with taking the vaccine. But if you could help us to understand, where is the greater risk? If you don't vaccinate, what is the risk to you? And if you do vaccinate, what kind of risks are there as well?
So that's a great question. And vaccines have been around for a long time. And hesitancy against vaccines is not new. So in COVID-19, there seems to be even more hesitancy. And there are a lot of reasons that people have expressed as to why they maybe are waiting or making up their minds about getting the COVID-19 vaccines. And so some of those include, I want to get more information, concerns about the idea that they were developed relatively quickly. Some persons are concerned about side effects. Some people think that getting COVID-19 is not so bad that I'll get over it, or that if I've had COVID before, I don't need to get a vaccine. And so it's very important that we raise awareness and educate persons and really try to encourage people to get to know the facts about these vaccines. They are more beneficial than risk. The benefit outweighs the risk, because essentially what vaccines do is they allow your body's immune system to protect you should you come into contact with COVID-19 without having to go through actually getting the disease. And we know that getting the disease, some people will not do well and die from COVID-19. And so safety was not cut short. All the usual steps in clinical trials happened before these vaccines were made available. And so it is a good idea to get the vaccines. They do protect against COVID-19. You asked about side effects. The majority of people will not have side effects from vaccines. A small proportion, maybe in the number of about between 10% or so, 15%, may have mild side effects. And those are the most common side effects. And those could include soreness at the injection sites. Persons can get a low-grade fever that is going to be temporary and short-lasting. That can happen within hours, up to a few days, 24 to 48 hours after getting the COVID vaccine. Headaches, tiredness, loss of appetite. They're generally short-lived and very treatable. And in some cases, there are very rare side effects in the number of a few cases in the millions of people who get these vaccines. And again, your healthcare provider can advise you, and the benefit at this time definitely outweighs the risk, and you will be protected. You'll be quite protected from being hospitalized and dying from COVID.
I've got to ask as well about the effects of the strain on the public health care system. If the hospital and the care facilities are at maximum capacity, what does this mean for the overall health care system? Particularly, you're talking about almost a year and a half now where healthcare workers have been grappling with this and working almost nonstop to treat, to prevent, and do all of these things.
Great question. So the healthcare system is at capacity at this time in terms of healthcare workers in this third wave, in the third wave surge. And we have seen that hospitalizations have gone up tremendously, especially in the last week or so. And we have to remember that when COVID is overwhelming the healthcare system, there's fallout from that in the simplest terms. And so what that means is that regular care is impacted. However, persons who do not have COVID still need care and will require hospital admission and usual hospital services. If the healthcare system is overwhelmed, that means that usual care will be impacted. And so you will see things like the ability to admit patients on other wards is going to be compromised. The ability to have procedures that are considered non-emergency may be reduced or interrupted. Clinics can be interrupted. There can be reductions in screening and test and the usual support that's provided. And so that's one immediate fallout from COVID-19. It impacts the healthcare system and the ability to diagnose and treat patients. And those effects are far-reaching. It's also very difficult for healthcare workers in terms of the care of COVID-19 patients, for long hours requiring a lot of personal protective equipment. And these persons have been working since the start of the COVID outbreak. And so it can be difficult with mental fallout and burnout for those healthcare workers too. And I want to say thank you for their ongoing dedication.
And I think
and
sometimes we forget that our frontline workers are still on the front line, even though, some of us have started to see some sense of normalcy return. Our healthcare workers and frontline workers are still out there on the front lines working, so I'm glad you brought that up. Just as we go into the break, one more question. Relative to numbers that we've seen, particularly in the month of July, where it seems that females seem to surpass the males in terms of confirmed new cases, what is this data saying to us? Is there anything in particular that you all are able to deduce from this at this point?
Well, it's difficult to deduce that just based on a trend from 1 month, but we are monitoring certain information, clinical and demographic information about the admissions and people who do get COVID and their outcomes. And so we're seeing that in this third wave, younger persons were impacted compared to the first wave. And that of those people that don't do well or pass away with COVID-19, that quite a number of them have other medical problems like high blood pressure, diabetes, kidney failure, obesity, and other things. And so we are looking at those trends, but I can't comment on any gender disparity right now or whether or not it's what we call statistically significant.
All right, Dr. Forbes, we've got a few more questions to give you. We're going to take a quick break, but don't go anywhere to our viewers. More on the record. We're looking at the new threat with the infectious disease specialist, Dr. Nikkiah Forbes. Stay with us. We'll be back right after this. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. And welcome back to On the Record. I'm your host, Jerome Sawyer. Tonight we're discussing the new threat. Are we indeed ready? Earlier this week, our news reporter Jasmine Brown had a chance to speak with the Minister of Health, the Honourable Renwood Wells, asking a few questions about the long-standing state of emergency. Here's a look at what he had to say.
The state of emergency ends on August 13th. If there's going to be any change to that, obviously the competent authority, the Cabinet of the Bahamas, would have to come back to the Bahamian people to say so. Right now, there's no discussions about changing the fact that the emergency order ends on August 13th.
Wells says if anything changes, the government will come to the Bahamian people in the shortest possible time.
In order to be able to do that, I do believe under the law you would still have to go to the House of Assembly, and the House of Assembly doesn't meet until the 22nd of September. We would have to call an emergency session. The Governor General would have to call the House of Assembly back into session to be able to do that. But as it stands now, we're moving forward as we would have intimated in the past, which is the emergency orders ends on the 13th of August.
And I am rejoined now by the Director of the HIV/AIDS and Infectious Disease Program, Dr. Nikkiah Forbes, as we seek to get some clarity on the new threats facing us. Dr. Forbes, we would have just heard there from the Minister of Health regarding the lifting of that state of emergency. Are healthcare workers, though, concerned that once this state of emergency is officially ended, that the government may be deemed a bit powerless when it comes to protecting its citizenry and the public health against what could possibly happen again if COVID gets out of hand? Is there a concern that once this is all lifted, then it's a free-for-all?
Well, here's what I could tell you. COVID-19 is not going away. It is here to stay as a circulating respiratory virus. And there are going to be waves of this that surge and hopefully then die down. And so people will have to protect themselves against COVID-19. What can we do at this time? There's no cure. There's no medicine that you can take that will definitely prevent you from getting COVID-19 that's widely available. And so this is what we will have to do. Vaccinations, they're the most promising approach to ending the outbreak here and worldwide. However, you need about 80% of the population immunized or immune against COVID, so that there can be few people that COVID can infect. And then it has to be two-pronged. When we think about prevention strategies, it must include the public health protocols and measures. So that will, if done in combination, will be helpful to protect people from getting COVID-19. We also have to think about other strategies like early identification of cases, tracing and isolating persons who have COVID-19 and putting high-risk contacts in quarantine. And then there are other protocols like workplace protocols, things that we do as, in terms of keeping persons safe. That's how we have to think about this as we move forward. Really and truly, restrictive measures are things that countries may resort to when the health system is significantly under strain and case numbers are very, very high and out of control. And that has to be done in tandem with some of those other things. And so I think that it is prudent for countries now to think about strategies of how they're going to learn to mitigate and live with COVID-19 in the long run, because, like I said, this is going to be here for our immediate future at this time.
Now, it would seem, from all indications that there's a lot of COVID fatigue. A lot of people seemingly have let their guards down, and it's natural. You're tired. You want to get back to life as normal. But two things. Really, have we put ourselves at risk or higher risk because of this COVID fatigue? And secondly, you would have mentioned in the last segment that young people appear to be presenting even more with this new strain, seem to be presenting more with more COVID cases, particularly when it comes to hospitalizations. Even in the United States, we see that young people are being hospitalized more. What do these things say to you? Are you concerned that, post-August, we're going to be so relaxed that we could find ourselves in a very serious situation? And then when you're talking to young people who, if I can steal the term, the young and the restless, they are the ones who really, really want to get back to normal, I think, faster than probably the rest of the population.
Well, there is COVID fatigue, and so people are tired of following some of the protocols, the public health protocols. And that can be somewhat risky, especially in the face of these emerging variants that are more infectious. And so I would just give the advice that there are things you can do to keep yourself safer or minimize your risk of getting COVID-19. And those things do work. And we know that COVID fatigue or people not following the health protocols, very well is contributing to the surge that we're seeing.
Well, I think this is a good place, too, for us to listen into our news reporter, Jillian Gray, who earlier this week had an opportunity to chat with the Assistant Commissioner of Police, Zhivargo Dames, just about the police forces, what they are doing, I should say, to enforce those public health safety protocols.
Over this holiday weekend, we would have cited some 5 airlines for allowing persons to enter the country without the requirement health visa. So the fine for each airline would be $2,000 plus $300 for the passenger who came on their airline.
Over the last month, authorities have issued 15 citations to airlines, according to Chief Superintendent Zhivargo Dames, and said 15 passengers were fined $300 each.
Anyone who is traveling on your airline, they must meet the requirements as laid out by the competent authority. And so no one is allowed to travel into our country without the required documents.
I have heard people, Dr. Forbes, complain about the travel visa and the restrictions related to travel, etc. Why is that still so important for us to have those safety protocols in place for people who are traveling into our country?
That's a great question, Mr. Sawyer. And what it comes down to is that there is still some risk of getting and spreading COVID associated with travel, especially in the face of these variants that are more infectious and can break through vaccines. And so it is good advice and prudent for the travel protocols to be adhered to, and for there to be some degree of caution taken when traveling to reduce the risk of getting COVID and spreading COVID.
A lot of us are traveling right now, or for the summer months. People who are, who now have the opportunity. Just very quickly, what advice would you give to people who are traveling over the next few months for summer or for whatever reason?
Thank you. I think that's a really good practical question. And so, again, the backdrop or the context is that there is some risk of getting COVID when you travel. And so the first thing to do is really weigh the need for travel. But like I said, COVID is not going away. So if you need to travel, you have to travel. There are things you can do to keep yourself safer. So definitely following the public health protocols, wearing a good mask that is going to filter well, and having that in place, wearing that when you're traveling, when you're going through places where there may be a lot of people gathered, for example, airports, check-in counters or areas in flight, is wise. When you get to your destination, that can be helpful. And, a lot depends on what the COVID situation is in your destination that you're going to. What is the vaccination coverage in that place? Are there variants of concern? You want to follow the public health precautions while you're there too, and minimize your risk. And certainly do that on your return. You should monitor yourself for symptoms. If you're feeling sick, if you have symptoms compatible with COVID or respiratory flu-like symptoms, then don't travel. If you develop those at any point during your trip or on your return home, you want to get a COVID test and stay at home, basically in isolation while you are having those symptoms. And those are some of the things that you can do to make travel safer.
This past week,
vaccination. Definitely, it would be wise to get vaccinated.
Well, yeah, I think, we keep saying this over and over and over again, and hopefully this show will inspire more people to get vaccinated, because I think, that's the only way out as far as I'm concerned. But anyway, this past week we saw the unfortunate passing of a 5-month-old baby girl due to COVID-19. What is this saying? I mean, it seems very unusual and, for a child of that age to have passed away. What is this saying now to us in terms of the data about this disease and about the effect it could have on everyone?
Well, thank you. That is unfortunate, and I am not the caregiver. I was not the physician that was caring for that child. And if anything we can learn about COVID is that we know that people of all ages can get COVID-19, and the outcome can be bad across all ages, and even children can die from getting COVID, which is not usually common for respiratory viruses. So with COVID-19, even very young, healthy people can get COVID-19. And so that should remind us, and we should remember that COVID can be very, very serious and lead to hospitalizations and death. And remember that there's something we can do to protect ourselves. And that includes following the public health protocols and certainly vaccinations when it's indicated.
Dr. Forbes, we're just about out of time, but I want to end on this note. You would have referred to it, I would have referred to it. There are still many people who are concerned about getting the vaccine in general, or even getting the AstraZeneca vaccine for whatever reason. This is our opportunity to make a plea to them. What do you say to those folks out there who are still hesitant? In the face of all of this information, you see hospitalizations going up, you hear people who are dying. These folks are largely unvaccinated. What do you say to those people who are saying, I'm still concerned, I don't know, I'm not sure? What do you say to them and the importance of all of this?
Thanks for ending on that note. And what I would say is try to get your questions answered and get the facts on vaccination. And if there are questions or concerns that you would like answered, please do get them answered. There are very reputable sites, the CDC site, the WHO site, your healthcare provider, the Ministry of Health Facebook page, and there are other opportunities to get the information about these vaccines. But I can tell you, based on the real world experience and our experience here in the Bahamas, these vaccines, all of them, work to prevent hospitalizations and death. And they're also very effective to protect against you getting COVID-19. And yes, while it is uncommon, there are persons who can be vaccinated and still get COVID-19. That's usually not the case. It's very uncommon at this time. And if that does happen to you, then you will just have mild flu-like symptoms and not have to be hospitalized or die. And so I would just reiterate that at our site, Princess Margaret Hospital, nobody that has been hospitalized or died from COVID-19 has been fully vaccinated. Just about everybody has not been vaccinated. And so please just remember, there's something you can do to protect yourself. And we will be here with this virus for a while. And so please do consider that it is an additional way of keeping yourself safe so that you don't end up in the hospital or saying, I can't breathe or dying from COVID. And I just hope that everyone can stay safe and that we will find our way through this and that we'll have high vaccine coverage. And that is our way out of this at this time. But thanks for inviting me to join you.
Dr. Forbes, I want to just again reiterate how grateful we are for you always giving us great information and always coming on the show, being so willing to talk to us and help us to understand and put this all in context. And you're right. A year ago, we didn't think, we were all hoping and waiting that we would be at this point where we have a vaccine. Now that we do, we have another struggle on our hands. And I'm just hoping and praying every day that more and more people see the wisdom in becoming vaccinated, because it really is our way out of all of this at the end of the day. So again, thank you so very much. Continue to do the great work. We appreciate you. The country appreciates you. So thank you so very much.
Thank you, Mr. Sawyer. Thank you for always being willing to help us raise awareness. And you take care and be safe until next time.
Yes, certainly. Until next time. Hopefully one day we'll say we have, a high vaccination rate and we're able to do all the things we love to do. But until then, we'll keep at it. And when we return, folks, we will turn our attention to the Pan American Health Organization and the World Health Organization's representative for the Bahamas and the Turks and Caicos. It's a discussion that you won't want to miss. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer. This is our final segment in the show tonight. We're discussing the new threat. Since the Bahamas rolled out its vaccination program in March of this year, nearly 100,000 doses of the AstraZeneca vaccine has been administered, with a whole lot more intended to go.
We have been offered some 57,330 doses of Pfizer through the COVAX facility. We will have a more definitive date when that vaccine will arrive, when Pfizer will arrive in country by Friday of this week.
The health minister was asked if the administration was considering vaccinating children as young as 12 years old.
Our kids are going back to school in September, and so obviously we need to be able to take that into consideration. And so that is one of the reasons why we sought to source Pfizer, because Pfizer is the only EUL approved vaccine for individuals under the age of 18.
Health Minister Dr. Renwood Wells. Well, my guest tonight is the Pan American Health Organization and World Health Organization representative for the Bahamas, Dr. Eldonna Boisson. Dr. Boisson, welcome back to On the Record. I know that we spoke with you soon after you assumed your position here, and I know you've been busy over these past few weeks and months. But let's talk first about the AstraZeneca vaccine, which has been the vaccine that's been distributed throughout the world, but in this context, in the Bahamas and the Caribbean. Now, is there a difference in terms of the efficacy rate of the AstraZeneca vaccine as compared to other vaccines against this Delta variant, particularly at a time when this seems to be the dominant COVID-19 strain that's moving around the world?
So good day, and thanks for having me back again. That's a very good question. In terms of efficacy, we would have been seeing a lot of numbers, percentages, efficacy of this vaccine and that one. The thing is, we have to know that those numbers are not comparable, because efficacy rates are measured at different populations, at different times, at different stages of their epidemics. And so we're not comparing like with like. However, what we do know is all the vaccines, AstraZeneca and all the WHO EUL approved vaccines, have been proven effective in preventing severe illness and death due to COVID-19 virus, all the variants of the virus, including the Delta virus. But it's important to know what it protects against. It's against severe illness and death.
There continues to be hesitancy, not just with vaccinations, but with AstraZeneca. People I talk to right here say, you know, I'm concerned about taking AstraZeneca. I'm going to wait on Pfizer, or I want to go get Johnson & Johnson. You know, what do you all continue to see as the overwhelming concern with AstraZeneca? And I say that in the context that millions of other people are taking it as well.
Yes, certainly. AstraZeneca has been used in most of the countries in the Americas and in many countries in the world for that matter. I think the public is much more informed about vaccines and their health and so forth. Once upon a time, people just went to the health center, got their jab of whatever vaccine they had to get, and they went home. Nobody asked what kind of vaccine it was and who approved it and the kinds of questions that we're hearing now. Health literacy is not a bad thing. It's a good thing. The problem is that people are getting information not always from the most reliable source. Again, I really want to reiterate that all the vaccines, including AstraZeneca, are very effective against severe illness and death. Now, some people are choosing one over the other, and I think it's because of the vast amount of information out there, and a lot of it not very accurate. And so people are comparing numbers that are not comparable. They're listening to information from sources that are not reliable. But our message really is get the first approved vaccine that is available to you. Why? Because the longer you wait, the greater you are at risk of getting COVID-19. And you know, sometimes I wish people could see what we see in our hospitals, for example. Otherwise healthy young adults, big strapping men, incapacitated, cannot move, struggling to take a breath. That is not due to the vaccine. Those are people who have not been vaccinated. That is due to the virus. So that would be my message.
There are people who have even asked, well, why would we take a vaccine that has not received FDA approval, the FDA in this instance being the Federal Drug Administration out of the United States? When that is brought to you or when that is used as an excuse, what is your response?
So the response is really an explanation of what approval is. For a vaccine and the manufacturer to get approval, they have to apply for it to begin with. And if that a regulatory body has not received an application, then whether or not the vaccine is good, they won't be able to approve it because they never had an application. Also, if a regulatory body determines that they do not wish to review a particular vaccine, then they won't approve it. And so you would find that the FDA would choose which vaccines it decides to review and approve. Many of them would have been ones that were developed in the US itself, which makes sense for the FDA. And so because a vaccine has not received FDA approval, doesn't mean that there's something wrong with it. In fact, if a vaccine has not received WHO approval, it may not be that there's anything wrong with it, but if in fact it has not applied and gone through the process, then it's not going to get approval. There are vaccines approved by the FDA before they get WHO approval, simply because they submitted their application to FDA, but they did not submit to WHO. And so that is the reason why it's not all about the vaccine being good or bad, but it's also about whether the vaccine sought the approval from that regulatory body and whether that regulatory body chose to review that vaccine.
And I think sometimes that we seem to forget that the United States and the FDA is not the panacea of all things health in the world, but because we are so close and we rely on them for so many things, or we look to them for direction in so many instances, we get a little sidetracked, or we get a jaded view of what is approved. Because as I say to people, we take a lot of drugs in this country that are not FDA approved, but it doesn't mean that they aren't good.
Correct. That is correct.
Why is it, or can you explain to us why the Pfizer vaccine may be the next vaccine to be introduced into this country, and why is it that only the Pfizer vaccine has been approved for use in children?
So those are two different questions, good questions. So why Pfizer? Let's take the first one first. Mm-hmm. Why has Pfizer going to be the next vaccine to come in through COVAX? So as the different vaccines got the EUL approval, then COVAX would have gone into agreement with the manufacturers to procure vaccines to be able to distribute through the COVAX facility. In addition to which, the Pfizer required some very specific conditions, some very ultra cold temperature freezers, which normally we don't have in the Caribbean. The vaccines we use don't require that. And some special types of syringes that normally we don't use. So countries also had to be prepared to receive the vaccine. That took a little bit longer for most of the Caribbean countries because we didn't have the freezers, we didn't have the types of syringes that were needed. However, those are being acquired. Some of the Caribbean countries have, others are in the process of acquiring. And so because COVAX has an agreement now with Pfizer, it is able to roll out more Pfizer vaccines. It's as I said before, what is first available. So what manufacturers can produce next is what Pfizer will roll out. They're not going to hold off for any particular manufacturer. Once they have the WHO EUL approval, they will, and they have vaccines ready to roll out, they will do so. Okay, so that's the response to that. Can you just repeat your
second question? Why is the Pfizer vaccine, could you explain to us why it's been approved for use in children?
Okay, again, in terms of the development of the vaccine, initially, I think you recall Pfizer was only approved for children, for persons 16 and over. And then there were investigations and the age was dropped to 12 and over. It all relates to what population the vaccine trials were conducted on. And initially, the vaccine trials for Pfizer were conducted on persons 16 and over. But since then, there's been further investigation on the population between 12 and 16. And we have found that the vaccine indeed works well in that population, as well as it is very safe for that population. So again, it's not a matter that other vaccines may not work, but we just don't have the evidence to say that yet. But investigations are underway, and we certainly anticipate that in the coming months, some of the other vaccines will also get approval for the younger ages. But at this point in time, it's only Pfizer that has completed that investigation.
So my next question, Dr. Boisson, has to do with travel. So as many of us become fully vaccinated, as borders open, as people in general start to move and start to travel, people are going to do things that they weren't allowed to do in the last year or so. I personally have been into U.S. cities where I have seen no masks. I have seen, people gathering in large numbers, a lot of the safety protocols on there. And it's almost natural because wearing masks and distancing, those aren't natural things to us. So you almost have a tendency to fall right into the fray of that when you get into a place where nobody's wearing a mask and, you don't want to be the odd man out or people have just gathered and you let your guard down. That's natural. So as we start to travel and as we start to do these things, what are some of the inherent risks that are going to come into place that we are going to see? Because people are moving. And you're moving into places where people are not, where they don't have the same safety protocols that we have in this country and others in the Caribbean. And naturally, you're going to assimilate, or our people are going to assimilate into that. What are the risks that we are facing with even capturing and bringing that virus back into our communities?
Very good question. And those are really important points that you raise. Certainly, you do try not to stand out and you fit in with the culture that you're in. The danger is this. The vaccines that we have against COVID now, as I said earlier, protects against severe illness and death. That means it helps not to overwhelm our hospitals. It helps not to cause people to be really ill and to die. However, we do not yet know to what degree we have protection from actually the virus infecting us. And we also do not know to what degree the vaccine will prevent somebody who may not be very unwell, just mildly ill or even asymptomatic, who has been vaccinated, from transmitting it to somebody else. We do know that the vaccine reduces the risk of transmission if you're infected a bit, but it's not complete. And so therefore, that is the reason why we say those protocols still need to be adhered to, because the only way we're going to break the back of this pandemic is to stop transmission of the virus. Until we get herd immunity, the only way to make sure that that virus doesn't move from person to person, whether people are sick or not, is to have those protocols in place. And many countries speak about their own percentage vaccination. And it's great. Every country has to strive to get the highest percentage they can. But until we all globally have reached herd immunity, nobody is safe. We saw how the original virus spread really quickly due to travel. And so any variants that come up can spread just as quickly. And once we have transmission taking place, variants will appear. Viruses change themselves. It's what they do, survival of the fittest, because people's immune system match a circulating virus. Vaccines tend to match the circulating virus. So the virus will do what it can to change itself a bit so it's not recognized by people's immune systems and not recognized by vaccines. Thankfully, we have not yet got a variant that is no longer responding to the vaccine. But the more a virus moves around, the more likely is we'll get another variant and another variant, and heaven forbid we get one that no longer responds to the vaccines, because we'll be right back where we were last year, March.
As my friends in the medical field tell me, a virus is very smart.
Yes, it is.
It's extremely smart. When we talk about herd immunity, I know that our health officials, our government officials are pushing the message that herd immunity really is the way to recovery. But when you look at our numbers, I think we're somewhere around 100,000 who have at least received the first shot. When we talk about AstraZeneca, and there are others who've traveled abroad to get vaccinated as well. But when you look at our numbers and you look at the rest of the Caribbean, where are we in terms of getting to herd immunity? And is it concerning to organizations like yours when we don't see the level of vaccine uptake that we would have expected by now?
So in terms of the rest of the Caribbean, the vaccine rollout in the Bahamas is going very well. The challenge really in the Bahamas and the Caribbean, in fact, the Americas, it's not about the rollout of the vaccine, it's about access. There is inequity in vaccine access around the world. While there are some countries who have well over 50, 60% vaccination, in some countries, they have less than 1% of their population vaccinated. Wow. And so, it really is disheartening to see the vaccine inequity, because as I said, until every country gets there, no country is safe. So for any one country to just look out for itself is very inward thinking and really is not protective of the world and of that very country as well.
You'll be politically correct. I'll call it selfish, but let's go ahead.
Yeah, but I mean, the Bahamas is doing very well in terms of rollout. There's been a lot of people, as you said, who have taken the vaccine. When we communicate with the vaccination sites, they are super busy. I think, we have 3 batches of people when it comes to vaccination. We have those who want it and they take it. They don't need any convincing. Then you have another batch who kind of on the fence, they're waiting to see, they're not sure, they want more information. These are the people that you want to give information to and inform them so that they can make an informed decision with the correct information. And then you have another batch of people who have decided, without a doubt, this is not happening, they're not taking the vaccine. Those are the harder nuts to crack. We still want to give them all the information that we can because we want them to make an informed decision too. So I think a lot of countries are sort of maxing out on those people who want the vaccine,
For sure.
Don't need convincing. And now in that middle group that you're trying to convince. So we're trying to overcome that vaccine hesitancy. And that's going to be ongoing. I mean, there will always be some people who do not want to have the vaccine for one reason or another, and it is a personal choice at this stage. So the best that we can do is to give people accurate information, try and debunk the myths so that they can make informed decisions.
As we get into my final question, I say to people all the time, you cannot rely on the University of Facebook or the Institute of Science and Technology via WhatsApp. And, these are the sources of information that we still go to. But I'm so happy that you said it. My final question, maybe a little bit controversial, but I've got to ask it. We have a very large immigrant and illegal population in this country, as do other countries. What should we be doing to look at vaccinating that group of people? Because the reality is they still live and work and move amongst us. And while, those of us who are entitled to it are getting it, and at a good rate, which I'm happy to hear. But what do we do about that population, and how do we address that?
So you're very right. That population lives and works amongst us. And my understanding from the Ministry of Health is that they are eligible for vaccination. Vaccine hesitancy in that group is also a concern.
Yes.
For different reasons, maybe they may not wish to come forward. So we have been working with the ministry to help to reach out, do some special outreach to those populations, translations and information in ways that they can easily access it, so that they do know that they are eligible for vaccines and they do also go and access those vaccines.
Dr. Boisson, thank you very much. And I just want to encourage folks out there too, if you do have people, who work for you in your home, in your business, who may not be, a resident here or citizens, you would encourage them, as well as I have from time to time, to become vaccinated. And I think we all have a responsibility. Again, it is a choice, but it's important, as you said, to give people the right information. And that's so very important in this fight. Dr. Boisson, thank you so very much. Great information as always. Continue to do the great work that you all are doing. We really do appreciate you, and thank you for taking the time to come to talk to us.
Thank you so much for having me. It's my pleasure.
Certainly. And that's going to do it for this week's episode of On the Record, The New Threat. Special thanks to my two guests on behalf of my technical team, myself, and of course to you. Thank you so much for watching. We'll see you next week, same time, same place, right here on The Record.